What does the change in the relationship with Kentucky One mean for the School of Medicine?
It means an exciting new direction. There have been some good things that have happened with the partnership, and there have also been some concerns that we've had, mostly related to University Hospital. So we still have a strong partnership with Kentucky One. We've got a long history of embedded programs in Jewish Hospital, a shared mission at improving the health of our community. That doesn't change. What really changes is really the management of University Hospital. Many of our faculty are also at Jewish Hospital, and as we go forward with this new partnership, we'll be renegotiating our academic affiliation along those aligned programs, continuing to strengthen those to the mutual benefit of both organizations. But then going forward, the management of University Hospital will revert back to the University Medical Center.
How will this change impact our students?
In terms of the students, their day-to-day educational experience will continue as it currently is. And that is to help in the team that's providing care for patients. It's to learn to be physicians in a very different, changing environment of healthcare. And I think what this also teaches students is about the change that's happening in our healthcare environment. And we know that that change will continue. There will be new things that will evolve as we look at changes now with an emphasis more on individual patient care to care for populations. If we look at individual physician to patient care versus the care of the team that provides the clinical care for patients. All of this kind of comes together, and I think it's going to be important. If you look at the specific requirements of our accrediting body, for example, with affiliation agreements, there's some basic elements that will continue to be the same. We need to have resources that are adequate for our educational program. There needs to be primacy of the academic program over the assessment of students. Students need to have resources like call rooms and lockers and logistical things like that, which will continue. And there needs to be a shared ownership of providing a constructive learning environment for the students. And then there needs to be a policy about needle sticks and accidental exposure for occupational hazards. So those things will continue. But same care, same mission.
And how will this now impact our residents?
That's a really, really important issue. For our residents, the care of their patients will continue as usual. We hope to actually increase our clinical sites for training for our residents. It's really important that we train the next generation of physicians to meet the workforce needs of the Commonwealth and beyond. We have training sites at Jewish Hospital in some deeply embedded programs that have historically been at Jewish Hospital and at Fraser. And we expect that conversations will continue and negotiations will continue to actually build those programs and strengthen those, building on the strengths that we currently have. And at University Hospital, we will certainly continue to focus on all of the areas that we need to provide the care to improve the health of our patients.
Why was the change necessary?
I think we needed more direct academic autonomy in the management of University Hospital. There certainly was expressed concern on the part of the faculty about some of the staffing changes at University Hospital and the obstacles that provided in their care of patients. There was concern about financial commitments that were made that we hadn't seen come to fruition. And what this agreement has done is to really address both of those major concerns. Financial commitments made will continue, And over the next 6 months, the commitments that were made will actually come to fruition, and there will be no changes in staffing in terms of reduced staffing, and our recruitment and retention of nurses and providers will continue at full speed, because that's what we need to help care for our patients.